everyone. I am Dr. Chandrakant Patil, MBBS MD, consultant physician working at Patil Care Hospital, Sankeshwar. So today we are going to discuss regarding of hypertension. So what exactly mean the blood pressure? Generally, everyone would like to be healthy and normal blood pressure, but exactly what does it mean? Each time and heart get pumps, it creates a pressure against the walls of the blood vessels, and it called as a blood pressure. So normally in a healthy persons, it rises and falls throughout the day. Throughout the when blood pressure remains high for longer period of time and left untreated, it leads to a serious health complication. In general, percent increase in blood pressure higher than the normal level, which called as a blood pressure. High blood pressure usually develops over a period of time. It can happens because of a unhealthy lifestyles, for example, not having enough regular physical activity, obesity, smoking, alcohol intake. So some other risk factor that can increase the risk of developing an hypertension, such as age. As as you get older, the arteries of your body get stiffens, which also increase the blood pressure. And second one is the family history. Family history is also important thing. If your parents or siblings are known case of a hypertension, there are chances of developing hypertension in the future. And the third one is the excess salt intake. So normally the salt intake should be up to 5 to 6 gram, but in case of a if you are known case of a hypertension, you should limit your salt intake less than 2300 milligram per day. Next, eating a processed and fatty food. Nowadays increase in junk food intake, so which is also leads to obesity. Later it leads to development of a hypertension. Another one is a stress. So stress as a day in a day-to-day practices, from children to younger and middle age, there are increased risk of stress, which later develops a hypertension in the future. So moving on a hypertension, uh, so whether hypertension have any signs or symptoms? Yes, it does, but initially it does not has any signs, obvious signs and symptoms. That's why it's called as a silent killer. So generally, when symptoms do occur, what are the symptoms usually present? It usually hypertension patient develop symptoms like headache, giddiness, blurring of a vision, and buzzing in the ears. So so healthy or a normal blood pressure should be lower than 120 by 80 mmHg. Here are upper number indicates the systolic blood pressure and lower number indicates the diastolic pressure. What does it mean, systolic blood pressure? So systolic blood pressure is the pressure in the blood vessels when the heart contract, and diastolic blood pressure is the pressure in the blood vessel when the heart is in relaxed mode. So if blood pressure is level is or more than 140 by 80 mmHg, the person is called as an hypertension. So the risk can be prevented and reduced by taking steps towards a healthy lifestyles. So as I already told, some risk factor which leads to increase in the blood pressure. So what are the things? What are the strategy to prevent blood pressure? These are some risks are the regular. So strategy are regular exercise, healthy diet, quitting smoking and alcohol, regular blood pressure monitoring, stress management, and adherence to medicine. So let we discuss one by one. So first one is then regular physical activity. Yes, so lifestyle modification is important in reducing the blood pressure. So regular exercise or uh, weekly 5 times a day, 5 times a week, five days a week reduce the blood pressure. So regular physical activities like includes jumping, running, walking, swimming, cycling, which leads to decrease in the blood pressure. Then mm, then second one is the quitting smoking. Yes, nowadays increase intake of alcohol and smoking is more in a society. So quitting exercise, quitting smoking and alcohol intake, which decrease the blood pressure. So third one is the regular and blood pressure monitoring. So regular blood pressure monitoring, it can be done either by visiting clinic and checking the blood pressure by doctors, or self monitoring at home. So self monitoring at home is the important thing nowadays. So self monitoring, so you can be measure the BP more than 5 times, 6 times a day. So it also assists the doctor, and also it reduce the complications of a hypertension like cardiovascular morbidity and mortality, strokes, kidney and eye blindness, which are all reduced by the self monitoring and control of BP at less than 140 by 90 mmHg. Then uh, healthy diet. So healthy diet, like green leafy vegetables, fruits, grains, and avoid taking processed food, high saturated fatty food also helps to reduce the BP. So one of the dietary approach is the dash diet. So what is the dash diet? Dash diet is a dietary approach to stop a hypertension. It includes the Mediterranean diet, like having a green leafy vegetables, fruits, whole grains, and decrease salt intake. That should salt should be restricted less than 2,300 milligram per day. And next, fifth strategy is the stress management. Yes, of course, stress is the most common thing nowadays, which seen from children to an younger and middle age. So stress managed by listening music, regular exercise, or you are talking with the loved ones and sharing your stresses to other persons, so that you can reduce your stress later. It also helps to reduce the blood pressure. And sixth one is the adherence to medicine. So after all lifestyle modification, after all quitting alcohol consumption and quitting smoking, if you have hypertension for a longer period of a time, so you need to go, you need to take anti-hypertension drugs if your BP is more than 150 by 90 mmHg. So once you are starting to take medicines as prescribed by your doctor, you have to strictly adhere to a drugs and a regular monitoring of your BP by either self monitoring or visiting to a doctor. So if regular adherence to your medicines, which also decrease your blood pressure and later complications of a hypertension. So at last, I would like to suggest that there is nothing more precious than having a fit and healthy lifestyle. Adapting a healthy lifestyle can also help us to enjoy long and a healthy life. So high blood pressure can be prevented as well as controlled in a many ways. So it is very much possible to maintain normal blood pressure. So thanks everyone for listening. Thank you.